Yes. That's what I say. Like when somebody asks me anything about hydrafacial, I roll my sleeves and I will just start because it's really crazy. And you guys should get the treatment yourselves once. When you guys are practicing, please practice on each other.
Yes.
Practice on each other. The reason why I'm telling is because I want you guys to understand and feel
how the effect,
how the product feels on your skin, how the vacuum feels on your skin. Because if you know what it feels, you will know what you're doing on your product. You need to know that.
You can explain the feeling.
Yes. Of how it feels. That's one thing. So this is your first screen. As you can see over here, you have protocols, you have modalities, system cleaning, treatment information. You don't need to go to all that. So protocols, you click your protocols. See, it's like baby touch. You just click it and everything just comes. You have your platinum facial, hydrafacial. You have your deluxe hydrafacial. You have your signature hydrafacial. Remember, these are the three main protocols of hydrafacial: signature, deluxe, and platinum. So if you have signature, deluxe, and platinum in your menu, you will just easily go and click either of these.
and then proceed
Step by
to
step. This screen is even better than the machine which I got over here because mine is demo machine. This has literally
This is
every
different.
single information. This is the latest model. Every single information it has. Even if you forget how to do it, just look and it's there. For example, I'll go to signature. Instruction. Start by cleansing the skin prior to performing the treatment. That means you will start manual cleansing, right? I'm done. Now it says exfoliation. First step is exfoliation. It says the vacuum that you need to be in 16. However, you can increase and decrease. I will teach you. We'll talk about how we can do that. Your treatment tips are here, like what it needs to do. Like for more aggressive exfoliation, use orange or purple. Blah 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 blah. Whatever instruction you need. Okay. Now, if you come here, it will show you what solution it is using. Active 4. What tip you need to use. You can use either blue, orange, or purple. Then it will show you, it will tell you what stroke you need to do. That means you need to do a long, fast, overlapping stroke. Do you remember for cleansing what we did with the blue tip? How did we do? We start with the chin. And then how do we do it? Yes. But so long and fast. Yeah, first we put the product because I want the skin to be saturated with the product, right? I don't want it to be dry and then dragging it up. So every time we do, I take the handpiece, I put the product first. With my hand, I will just spread it. And then the motion would be
up,
long and fast. You remember this, right? So that's what it says. So it's already in the screen, right? That's one thing. If you forget the pattern, let's just say worst case scenario, which you will never
there
forget.
is a suggest pattern.
Wow. Easy?
Yeah.
Yeah? But you wouldn't have to go to this. Because when you practice in 2-3 phases, you will remember this completely.
This is like they put the amount of the cream.
Yes.
And then you start
Yes.
how to apply
Yes.
it.
Yes.
Inside, outside, inside, outside.
Yes.
Step 4.
Yes.
Tick, 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 tick. And then.
Yes.
So it's like skincare
Yes.
things, but with deep. It's like
Yeah.
it's like a normal laptop and Macintosh laptop. Let's say.
Yeah. You just need to know what the vacuum is like. Are you safe to use it? Just absorb the skin. That's all you need to do. Rest you're good to go. Okay. So that's your first step. Then you go to the next step where you use glycol. You remember this, right? Glycol. Then again, that also tells you what solution to use, what tip to use, anything to use. Next step, you do extraction with your beta HT. What tip to use? Steel tip to use. Then next, you use anti-ox. And then you're done. This is your signature, basic cleaning. That's it.
This is the basic.
And you go home. Then if you want to do deluxe, same thing. You start with exfoliation, glycol, beta HT, booster, one booster for this one. Light therapy.
Light therapy is like for to bright the skin.
Light therapy is again, like I said, red or blue light according to what you want to do.
Light, okay.
Yeah. And then you do the anti-ox and you go home. I mean, it's done, right? Then, if you're doing platinum, full-fledged, okay? You do your lymphatic. You start with the lymphatic. Exfoliation with your active 4, your glycol, beta HT, your booster, whatever number of boosters you want to use, LED light therapy, anti-ox, and that's it, you're done. This is your full-fledged treatment, platinum. Somebody who's your VIP, who's paid the full amount, will come into this.
So
These are the 3 types.
So this one, we will just follow step by step.
Yes, step by step.
We cannot jump into.
Yeah, you don't have to go.
Yeah,
to
because if we didn't have like this, maybe we can jump to the next step or mixing the steps.
you can do it. See, that's what I'm saying. Like
Yeah.
once you have mastered how to use the machine, you can go back and forth and do this, or maybe, oh shit, I forgot to do this, and I'll go back and do this. Or you'll be like, I want to add more booster. So you stay in the same page and still do it.
Like you cannot apply the mask before the scrub.
Yes. Same thing.
Same
But once
technique.
you know how to go back and forth in the machine. So 2 things after this training, what I want you guys to do is play around with the machine. Switch it on.
Go to the catalog.
Yeah. Go to this thing and then get used to. Suppose you're saying like I have a patient here who wants to deluxe. Get used to clicking fast and going to deluxe and going through it. I just want you guys to be acquainted with the machine. Get used to opening the machine, clicking it, putting it off, getting the product out. All of those things.
For example, this one, how we gonna change them? Let's say.
Yeah, I'll teach you in the hands-on. So
Okay.
when we do everything together.
And how we gonna know that it's like this one, it's finished?
See the line? Yes, it will be empty.
So the color will change.
Yeah. It will be empty now.
Cool.
Okay? So anyway, so when you are in any of the protocol, and for example Active 4, if you want Active 4 solution to come out, you have to switch on this toggle. Once you're done with it, you'll put it off. If you put this on and this on, both the solution will come. You're wasting product, the skin doesn't need it, it is harmful. Also money waste. So remember,
So we have to adapt ourselves to the
Yes.
machine that
Yes.
much that we can, so to know all the.
Yeah.
Yeah. Okay.
so what I want you guys to do is like play around with the machine. When you're on Active 4, open this, switch it on, make the product come out if you want to, no need, but switch it on. Then remember to switch it off. Then go to the next one, switch on, remember to switch off. Get used to that. Just today you get used to that. Tomorrow when we do the hands on, it'll be easier when I tell you guys to do this. You'll automatically remember switch off and switch on. Just get used to that today. That's it. Okay? And go and explore like what I can do. So that is your signature deluxe and platinum. This is clear to you? Till this everything is clear to you guys? Any questions so far?
Everything. Is
Any confusion? Stop me right when you have
It will be our new telephone.
Telephone.
It's
Yeah.
like when you have a new telephone, you discover everything.
Yes.
Yeah.
Okay?
Okay.
Any questions at this point?
No. So
Perfectly clear?
Yeah.
Okay. Now, if you want to do your body hydrafacial hands,
Continue.
same steps.
Body hydration, hands. Okay. Oh,
Upper.
inside and outside.
That's it. We don't have any other steps to do.
Only that
So you
stroke.
do exfoliation with your Active 4. Then if you want to put glycol, you can put glycol. Then you will do anti-ox. In this case, we will not use extraction with beta HT, the second solution. Reason because you don't have blackheads and whiteheads.
Yes.
Let's say we start the procedure for the hands. Let's
Mm.
say, how many minutes it takes like for each hand? Let's say.
I would say 3 minutes for glycol, 15 minutes.
Both.
Yeah.
Both. Okay.
15
Because we
minutes.
have to know this
Both
also
hands.
because.
Yeah, 15 minutes
It
max.
depends of
For
the
beginners?
appointment.
Yeah, no, for any, like if just coming for hands, like 15-20 minutes max.
Because only one.
20 minutes I'm saying because if you guys decide to give them a 30-second massage when you're done, including all that, it will be 15 to 20 minutes. That's it. Then you go home. And then you go to your next, which is your back
Right, back.
hydrafacial. Same stuff, right? You start with your Active 4, choice of glycol, same thing.
I mean, like the machine would not tell me that, like, for example, or give information like the session it's done. So it depends on us.
Yes.
This is what I mean.
Yeah. You mean like each step, right? You know that for each stroke it's 1 or 2 passes only.
Yeah.
You know that, right? So they can only do 1 or 2 passes. Like when I'm doing cleaning, I'm moving the handpiece, right? So I did one pass and then I'll do one more pass and that area is done. Then I'll go to the next area and do one other pass.
Yeah.
So I will not
Twice.
be continuously doing it. It will be like I'll just do 1 or 2 strokes.
Maximum.
Maximum 2 strokes.
Got it.
Okay?
But what if we can still see dirt on the face? Can we do multiple passes of
Then
that?
that means you are not being efficient with the vacuum. You need to either increase the vacuum or you need to put in a little pressure. Little pressure. Just a little pressure. But remember, when I tell you pressure also, always remember guys, this machine is a smart machine, okay? You are not working for the machine is working for you.
Exactly.
So, never apply pressure on the skin.
We are only the hand.
Yes, you're like the car and the Google Map is telling you where to go. So what you are essentially doing is you're only making the handpiece move in that direction. You don't want to apply and you are not putting any pressure. No. You will show the machine where to go. Let it do the job for you. You increase the vacuum or increase the amount of time that you're leaving the acid on. That's how you get the result. We will dwell deep into it when we do the hands-on. Don't worry about it.
How's the cleaning of our beautiful machine?
Only 2 times during the treatment. During the treatment, you will do the cleaning of the machine.
2 times.
2 times. When are the 2 times?
Before and after?
No. After, yes. But there is one time that we clean the machine.
Before we close, example?
Middle.
In the middle where? You remember this, you know this.
What we do?
We use this rinse away to clean the machine in the middle of the treatment. At what point do we use that? Do you remember that?
Maybe for this.
No, for all the treatments. Any treatment you do in the middle of this procedure, you do it. After acid treatment, after extraction.
Acid treatment.
After extraction, after using beta HD. Reason because you will have acid flowing through these tubings. After acid treatment, you're cleaning the
You
skin
need the
to
wash.
put whatever nourishment you need to give. At that point, you want your tubing to be free of acid and any impurities. So at that point, you will clean the machine. Yeah? Because you want that flow to be clean.
So, and in the treatment.
After acid treatment.
Yeah.
Maybe.
Acid treatment as an acid after extraction.
Beta HD, I mean. So how many minutes for that? For the cleaning?
5 seconds.
5 seconds only.
Yeah.
Okay.
Now in this machine tomorrow when we do the cleaning,
It's just like
it's
flushing.
even more smarter than that other machine. It will prompt you. Even if you forget, the machine will prompt you to clean it. To clean the face and the skin and the machine. So you will simply switch this on and click clean. The reason why it didn't show now is because the machine knows there is no procedure
No
being
need.
done right now. Tomorrow you will see that happening. So that's your protocols. Then you have your neck and décolleté, you have your keravive, which is for the scalp. You remember this?
Yeah.
hair.
Keravive.
Then the perk for the lip and eye. So all your treatments are on this screen. You simply have to select which one to do.
But Caroline,
Yes.
for the eye, how is the procedure? Like the movement?
Yeah, I'll show you.
Or for me, I believe it must be inside, outside as
But
well.
we will not do it. Yeah,
No,
it will be
not
here.
direct
Yeah.
here.
It will be on this periorbital.
Yes.
This area.
This one,
Yes.
the bones.
Yes, the bones. So it will be around this area only. Nowhere close to this eye.
Yeah.
Okay. Suppose we want to see the eye.
As the serum and eye cream.
Yeah.
Not too
That one. Outside.
Yeah.
We will do this. We will do all these
Beautiful.
treatments.
Beautiful.
Same for the
Lips.
for the lips. See that?
Should be going inside.
We will be going from here. You know why we're doing that? Because the vacuum is going to allow slight plumping of the lips. Because if you guys have noticed, when you scrub your lips kind of perk up.
Like
Yeah.
this, yeah.
Right?
Pop.
So imagine what the vacuum can do. Again, remember
If
it's not
we
permanent.
towards outside, it will be like
It
this.
should be like you're
Pump.
taking it, pumping it outside. Now remember, this is not a
How?
permanent solution. It's
Yeah.
a temporary solution. If you have an event, come here, get it done, go for a few hours, you'll look.
So
look all
for the
perked-
party, like
yeah,
that.
you look all perked up and juicy. But of course, as the night ends, the buck ends.
Is this advisable for those who just had their lip fillers?
No.
Uh,
I think say no.
Not on the same day.
Okay,
No.
But you know what? Let them get this done and then go get the lip filler
Then
done.
after.
Because
So it will absorb the.
Yes.
Mm.
Also, the
Clean.
reason because this is really good if your lips are like chapped
Mhm.
and dehydrated.
oh dear.
Corinne, this is
She's like getting so
for
happy.
me, I think that example when we have a patient,
Yeah.
you're gonna have a Botox or filler.
fillers.
So we can advise her.
Yeah.
To do it first.
for great
Yeah.
results.
Yes.
So I can advise you to go for this
Yes.
hydrafacial.
Mm.
Yes.
What it can help me? What can it give me as
To absorb more the
Yes,
filler.
Exactly.
Yeah.
Unfortunately,
Yeah.
unfortunately, for example, we it's good to advise this, but if the patient is talking to doctor, we cannot, advise do this first before. Like,
No, the doctor sometimes can advise as well.
Yeah.
The doctor, it
already
depends
knows.
Mm.
from
But-
the body language of
Yeah.
the clients.
Yeah.
The,
The
the
doctor
doctor
would
knows
know.
as well. Mm.
But like Ruby was saying, like you guys can do this. You know when they come to you for a treatment. Like see, what I always tell all my clients is, we should let them know that we can do this.
Mm.
Only that because the customers are not aware of what you guys can offer unless you guys tell them,
Yes.
right? So imagine she is coming to you for a laser hair removal, okay? Let's just say she's coming with removal. You notice she has chapped lips, or she needs to do, or she's a person who always does fillers or Botox. She loves to do lip treatments or injectables. That's your cue to tell them, listen, we have something like this available. If you want to do it, do it.
So advise her.
Yeah, just make them aware that you have something like this. One thing. Another thing is, I always suggest my clients that lip and eye treatment could be something like a complementary treatment.
Got it.
So somebody who does, somebody who's doing like 3-4
Like
times
nurse
eye
checks.
treatment. Yes.
Mm.
So you guys can be like, you know what? We're having a good day today. I'm just gonna give you one eye treatment.
Especially if like during the procedure,
Yeah.
or you notice that she's going for party,
Yeah.
wedding,
Yeah.
she's a
she had full
bride.
body
Yeah.
laser.
But
Exactly.
you guys can also take the call, but of course after deciding with them, because
Yeah.
they would know how many treatments they are doing and what they are up to, right? So if you feel like this client is very valuable to you, this client is very loyal to you, go and take their advice and ask them, do you think I can give them something like this? And if they seem it's right, go ahead and do it. You've earned a client. You know what I mean? So lip, eye, lymphatic light, all these things could be something that you guys feel like, I want to pamper my client, and I want this loyal client over here to come back to me, so I want to get it done. Best part about lip and eye is, this product is like a pen. You will use only 50% of the product over here. You will send the rest of the product back with your client. So the client will
They
have
will-
a product to take back at home with. The product which you're using, you will use over here, and the 50% of the product is still
They can
remaining.
take
You
it,
will
take
give it to
home.
them. Take it home. They
Then
will
use
go
it.
home and they will just
Then
wear
use it.
I'm gonna open this one, okay? Because we'll never use it for demo, I believe.
The product is from USA as well, no?
Yeah, of course, yeah.
Everything.
Yeah, just of course everything. Yeah. This is what it looks like. Okay, this is the vacuum tube which you put on top of the pen, which is this one. You'll insert it.
Ah,
and
it's a
on
pen
this tube,
type.
You will remove it, and then you will move it. Okay. Now you see the solution in this, right? You see the
Yes.
solution? You see the solution?
Yes.
Oh yeah. I saw.
Yeah.
Now this solution, you will only use 50% of it. You can see it when over here you can see it. Okay, when you remove the plastic case. Once it reaches 50%, we'll remove everything, put the cap back on, and we take it home. Now they will use this day and night, roll it and use it. They will really see a difference. It will be super moisturized, super peppermintish, which will also stimulate some kind of plumpiness. Okay, softness, everything. Okay, it will be really nice. When they finish this product, they will come back to you for the next treatment. That's how often they can do the perk eye and perk lip. Same for the eye. They will take back the product, and then they will come back. Clear? So that's how efficient these products are. That's how easily you can get them to come back to you guys.
I'm very excited to practice on the machine.
Yes.
I want to because my lips are always dry.
Should try it. You should try
Yeah,
the
we'll
products.
try it.
Like you guys should all try the products on all of you guys so that you know what you're talking about.
Mhm.
I'm able to talk so much about the product because I know this in and out now.
Mm-hmm.
Like I know what each of this product does because I'm used to it on me. I do hydrafacial every 2 weeks. So you guys should get that thing like okay, this is what it does.
Like I mean,
We do it every 2 weeks.
each lady who taking care of herself, like who's using serum,
Mm.
twice a mask facial, like a mask at home, or scrub and
Scrub.
these things. So she's gonna have a nice skin. So imagine with this product and this machine, so
It will absolutely.
Absolutely.
double,
And
double, double, double,
yeah.
The effect.
Yeah.
Skin
Because
will-
it will absorb all
everything.
the.
So whatever skincare regime she's doing at home will be much more effective because you're really getting to the root of the problem of the
Yes.
skin. The root problem of a skin is because the skin is having oil, makeup, dirt, impurities, all accumulated. You know? So you're really removing that equation.
Everything.
You're removing the problem itself from the root. That means you're eliminating that and you're keeping on flushing it with good products. You'll only see good results.
Karen, what about this like white things? It goes
Whiteheads.
yes, white
Even that
heads
will be removed.
as well.
Yes. Blackheads and whiteheads.
But my blackheads are stubborn. Super
Yeah.
stubborn.
Which is why you will have to such clients, like if there are clients like yours,
They will repeat it.
you will have to put them in packages. Tell them, you know what, let's do 4 to 5 sessions. Book 4 to 5 packages.
We
For
have
sure, you believe that in first session it will giving you
we have nice package.
yeah. I'm asking like you as a person because you've seen like 3 demos we did, right? 3 or 4 demos we did. Do you believe like from the first session itself you saw a good difference?
Yeah, there's a good difference, but they already have good skin. What about if they have skin like mine?
No. I'm talking about the blackheads and whiteheads only.
Ah.
Forget about any part of the skin, okay? You believe you saw a difference in the nose?
Yes.
Yes? From the first session.
Yes.
Let's just say, worst case scenario, you saw only a 20% difference. That's still a difference that you're showing through the machine. And they're seeing physical evidence with their gunk bottle. Okay? Another thing, no machine, no tool can remove 100% of your blackheads and whiteheads.
Of
No
course.
worries.
I don't want to miss that.
No worries.
It will
No
take.
machine- No machine can do. Even when you do manually,
Yes.
you can only do so much. You can't do the entire removal. First thing. Second thing, if you happen to do it, you are destroying the skin's texture. First thing. Second thing is, even if you happen to do that, you can't. If you remove 100%, the client will not come back. That's
Yes.
another side of it. Let's not go to that side of it. But I'm saying it is impossible to remove. Can I just put my phone on silent?